Hello, I'm Dr. Bugman, and welcome to Counseling 6573, Psychopharmacology and the Counseling Profession. This introduction will provide the information that will help you prepare for our course journey. Here's a question that you might be asking yourself. And so let's take a moment and explore this question further. In doing so, it may be helpful to be aware that prescribers only see patients a few times a year, and when they do, it is only for a few minutes. This means that it's typical that most counseling clients prescribed psychotropic medications have not had the opportunity or time to discuss their questions and concerns about the medications with their prescriber. Therefore, they frequently turn to their therapist for help. To illustrate this situation, please take a moment and imagine that you are the counselor in the following scenario. This is a client that you care deeply about, and you've worked hard to develop a therapeutic relationship with them. The scenario is that your client, after a short 5-minute consultation with a family physician about feeling depressed, has been prescribed an antidepressant. Having formed a trusting therapeutic relationship with you, see if you can answer the client's questions. I read on the internet that taking antidepressants will make me addicted. Is that true? If I take this antidepressant, does it mean I am too weak or too crazy to be helped by counseling? How does this antidepressant work in my brain to help me feel better? Are there side effects that I need to be aware of, or foods or other medications that might interact with it and harm me in some way? How long should I take this antidepressant before it starts working? So, how did you do? If not very well, don't worry. This course will prepare you to ethically and professionally handle these types of situations in the future. I'm also hopeful that this brief exercise will help you see the relevance of this course and possibly help you become motivated or more motivated to do your best to develop a solid foundation of evidence-based psychosocial knowledge and skills that will serve you well in your work with clients. To understand this course and other changes to the clinical mental health counseling program, which will be discussed in another presentation, one must be aware of how three powerful forces, evidence-based practice, the neurosciences and brain research, and human diversity have and will continue to have an influence on your counseling education and practice as a counseling professional. Starting in the late 1990s, clinical mental health counselor education and the counseling profession have increasingly been influenced and shaped by an emphasis on evidence-based clinical decision-making and evidence-supported counseling treatments. The neurosciences and brain research and the need for mental health professionals to be trained to work with client diversity in all aspects. That includes cultural, sexual and gender identity, race, ethnicity, socioeconomic status, and the client's ability. So let's do a quick review of how these three very powerful forces are influencing the counseling education, our counseling program here at SAU, counseling program accreditation, the counseling profession, and finally this course. So, what is evidence-based practice? Well, this means that mental health professionals, including a variety of them, counselors, psychologists, social workers, they all must base their clinical decisions and treatments on the most current research evidence and then be able to tailor those decisions and their treatments to each unique client's personal characteristics, culture, and personal preferences. You can see the influence of evidence-based practice in our ACA Code of Ethics, in which it states in 2014 Section C, under professional responsibility, the introduction, counselors have a responsibility to the public to engage in counseling practices that are based on rigorous research methodologies. Also, the Council for Accreditation of Counseling and Related Educational Programs, which we typically refer to as CACREP, C-A-C-R-E-P. This is the body or the accrediting body for determining the quality and credibility of graduate counseling programs. Relevant CACREP standards require clinical mental health counseling faculty and clinical mental health counselors in training, that's you, to use current counseling-related research that is based on rigorous methodology in their courses, for example, in assignments and even in course discussions. Also to use this research to inform the development of their own evidence-based practice with clients, and to learn how to implement evidence-based counseling strategies and techniques for prevention and intervention. In terms of this course, Counseling 6573, this course supports the ACA Code of Ethics and meets CACREP's accrediting standards by emphasizing the use of current biopsychosocial research that is based on rigorous methodologies to make clinical decisions, to select evidence-based biopsychosocial treatments, and when participating in course discussions. So now let's take a look at the influence of the neurosciences and brain research on counseling, including our course. So in 2009, Counseling Today published Counseling and Neuroscience, the Cutting Edge of the Coming Decade, in which the author stated, counseling builds new brain networks. Research in neuroscience and cognitive science is highly supportive of our emphasis on listening, empathic understanding, and building strengths and wellness. Somewhat surprisingly, neuroscience's findings on the brain result in a more complete awareness of how environment and culture shape the individual. The bridge between biological and psychological processes is erasing the old distinction between mind and body, between mind and brain. The mind is the brain. You can also see the influence of the neurosciences and brain research in our CACREP standards. They require clinical mental health counseling programs to include evidence-based neuroscience and brain research so that counseling graduates can participate and compete for jobs in our evolving profession. In our course, Counseling 6573, these CACREP standards are addressed by teaching and applying evidence-based neuroscience and brain research to case studies and discussion topics. Another way that you can see that this influence is that recently there's a form of therapy called neurocounseling. And the development of neurocounseling is due to the growing influence in counselor education and the counseling profession. Last but absolutely not least is human diversity and human diversity research. As you know, this force is about the need for mental health professionals to be trained to work with client diversity in all its aspects. So at SAU, in addition to 6473 counseling in a diverse society, all clinical mental health courses should include evidence-based information about human diversity and how counselors use this information to tailor their clinical decisions and counseling treatments to each unique client. CAPE counts human diversity and human diversity research as one of the 8 core competencies that represent the foundational knowledge required of all entry-level counselor education graduates. In support of and respect for this core competency, this course includes information about the intersection of diversity and psychopharmacology. Well, this concludes the introduction to Counseling 6753. So until next time, goodbye.